All right, we're going to dive into a really powerful treatment for some common male sexual health issues, and it's something a lot of people have never even heard of. The best part? It gets incredible results, and it doesn't involve a single prescription. So, let's get right into it.
So let's just start with a big question, one that kind of flips the script. We're so often told that the solutions to our health problems come in a bottle. But what if the real key to better sexual function is already a part of our own anatomy, just waiting for us to understand it?
To answer that, we really need to meet the main character in this whole story, a group of absolutely crucial yet almost completely overlooked muscles.
They're called the pelvic floor muscles, or PFMs for short. The easiest way to picture them is like a muscular hammock or a sling right at the base of your pelvis. Now, yeah, they're super important for things like bladder control, but they are also absolutely vital for sexual health. We're talking directly supporting erections and controlling ejaculation. And it just makes sense, right? If these muscles are so important, then it stands to reason that when there's a problem with them, it can lead to dysfunction. And you know what? Research shows this is a huge, but often completely overlooked root cause. What's so fascinating here is that the problem can go one of two ways. It's not always about weakness. You can have overactive muscles. They're basically too tight, they're clenched, and they can't relax. That's often linked to things like premature ejaculation and even pain. On the flip side, you can have underactive muscles that are just too weak to contract when you need them to. That's often connected to erectile dysfunction. See? Two sides of the very same coin.
So, if the problem is fundamentally about muscles being either too tight or too weak, well, the solution should target those muscles directly, and that is exactly where pelvic physical therapy comes in.
And look, this isn't some new age theory or a wild guess. The information we're talking about today is grounded in a deep dive, a comprehensive review of 26 different scientific articles, including randomized clinical trials. This is solid evidence-based medicine. In fact, the research for this explainer, which was published in a major medical journal, makes this really powerful statement. They call pelvic PT an evidence-based first-line treatment. Let's just pause on that phrase, first line. That means this isn't a last resort. For many people, it should actually be the starting point.
Okay, so what does this therapy actually look like? It's so much more than just a single exercise. A pelvic physical therapist has a whole toolkit of techniques they can pull from, and they tailor it to exactly what you need.
Of course, the foundation is pelvic floor muscle exercises. But this is way more nuanced than just doing Kegels. Seriously, the first step is just learning how to feel and connect with these muscles in the first place. From there, yeah, it's about building strength and endurance for control, but, and this is just as important, it's about mastering the ability to fully relax and let go of tension. That relaxation part? It's an absolute game changer.
One of the biggest challenges here is that you can't see these muscles working, right? That's where a cool technology called biofeedback comes in. A therapist can use sensors to show you your muscle activity on a screen in real time. This visual feedback makes it so much easier to get that mind-body connection going and to really fine-tune your control over both contracting and relaxing.
Therapists might also use a tool called electrostimulation. And don't worry, it's very gentle. These little electrical currents can be used to do different things. For those underactive, weak muscles, it can help with strengthening. But for those overactive, tight muscles, it can actually help them calm down and release tension. It can even help retrain the ejaculatory reflex. Pretty cool. And the therapy doesn't just stop at the pelvic floor itself, because, these muscles don't exist in a vacuum. Therapists use hands-on techniques to work on connected areas like your lower back and your hips. They can release those painful knots or trigger points and improve joint mobility, which can lead to a lot less pain and way more comfort during sex.
But an effective program isn't just about the physical stuff, the techniques. It's really about a holistic approach, one that truly connects the mind and the body.
This brings us to probably one of the most critical takeaways from the research. If your muscles are already overactive and tight, trying to strengthen them is just going to make things worse. The absolute #1 first step for healing is teaching those muscles how to let go. Relaxation has to come first.
And you know what one of the most powerful tools for relaxation is? It's something we do all day, every day. Breathing. There's a direct physical connection here. When you take a deep breath in, your diaphragm moves down, and that encourages the pelvic floor to gently relax and lengthen. Then, as you exhale, it naturally lifts back up. Learning to coordinate your breath with these muscles is an incredibly powerful way to gain conscious control.
Therapists also zoom out and look at the bigger picture.
They encourage lifestyle changes that directly support sexual health. For example, things like regular aerobic exercise don't just improve your fitness, it's also been shown to help with pelvic floor coordination. It can boost desire, and it can even reduce the risk of erectile dysfunction. It's all connected.
So all of this brings us to our conclusion, a new path forward that really rethinks how we approach these very personal health issues.
This whole therapy fits perfectly into what's known as the biopsychosocial model of health. Now, that's a mouthful, but all it means is that our well-being isn't just about biology, like how a muscle works. It's this complex dance between our biology, our psychology, like our thoughts and feelings, and social factors, like stress. A treatment that really works has to address the whole person.
And that, right there, is the ultimate power of this approach. The research is clear. The real key is creating a personalized plan in collaboration with the patient. It's the total opposite of a one-size-fits-all pill. It's a journey that empowers you to address your specific concerns and to take a really active role in your own health.
So we'll end with this thought. We so often look for external solutions to our problems. But maybe, just maybe, the real future of wellness lies in looking inward, in gaining a deeper awareness and understanding of our own bodies and harnessing their incredible innate capacity to heal and to function at their best.
All right, we're going to dive into a really powerful treatment for some common